So good evening, everyone. Welcome to today's IVPN Clinical Research webinar. Once again, thank you for joining us. It's my pleasure to moderate this session, which is titled From Literature Chaos to Clinical Clarity, Mastering the Systematic Review and Meta-Analysis. Just to give you a bit of background, in the global reform, where scientific literature is growing faster than ever, the ability to critically synthesize evidence is not just a skill, but it's a research survival tool. Therefore, whether you are a student, whether you are a researcher or a healthcare professional, you are in the right place. It is my honor to introduce our distinguished speaker for tonight, Dr. Somia Fatima. She's an accomplished researcher with over 30 scientific publications. She is also the founder of Research Mentorship Program, which has supported over 1,000 students and more than 169 research projects across the range of study designs. Her collaborative research network extends across Pakistan, India, China, with a very promising expansion into the Middle East soon. Dr. Somia is also an internationally recognized speaker. She had presented at 32 conferences, including 23 international events, and she has been invited to share an expertise in the UK, US, Canada, Turkey, and Malaysia. Tonight, she will take us through a highly practical approach to boost the research literacy, moving from the scattered literature into a structured evidence synthesis. We will allow you to ask many questions, but please write them in the chat box, which will be answered almost at the last 10 minutes of this session. With that and without further delay, please join me in welcoming Dr. Somia Fatima. The floor is yours.
Thank you so much, Dr. Salam. Okay, so good morning, evening, or night, wherever you are joining us from. I'm really excited to be invited as a speaker for this session. And one thing I can let you know, as a clinical researcher, this is the stuff that I live and breathe. Okay, so during the session, there would be some parts that would be a little bit technical, but be sure that I won't be including too much intricacies and will try to make it as crisp as I can. Okay, it would just be a short session around and all. And one thing I can promise you guys that by the end of this session, you would be like, yeah, systematic review is really easy and I'm excited to start systematic review. Okay, so let me share my slides. Okay, let me start. So I hope you guys already know what we are going to talk about today. It would be about systematic review and meta-analysis, okay? When I started research, I had this thing, systematic review is very complex, it's very difficult and all that stuff, but you guys cannot understand when you get the hang of it, it's so easy and it's so good. It's like the top thing that you can ever do in research, okay? And let's start it. These are some of the steps that we will be talking about in our session, and I would just be touching upon them. The first step is the topic selection. Then we go for the PCOS formation and Prospero registration, okay? The second step is primary and secondary screening. You guys don't need to be afraid of these terms. Yeah, I will be explaining them in a while, okay? Third step is data extraction. Fourth step is analysis. Then we go to quality assessment. And at the end, we have manuscript writing. Okay, so like these steps, the most important step is, of course, the topic selection. When you have decided on a good topic, it's the best thing you can ever do for your CERMA. It increases your chances of publication automatically, okay? So a good topic is the best thing to go for. So we have to spend some good time on the first step, and we will be discussing about these terms. What is primary and secondary screening? It is, in a way, you can say, filtering of all the available studies on your topic. Okay, for example, I go for a topic like the problems that paracetamol cause in pregnancy, okay? Or does it lead to autism or anything like that, okay? So, if I have to see is I will just extract all the studies, all the literature that is available on it, on this topic, and that is known as a primary and secondary screening. Then I will extract data from it, I will analyze it, I will run some quality assessment, and then I will write my article, okay? One of the most important questions that I am mostly asked as a mentor of my research program is how much time will it take? How much time will it take for me to write a meta-analysis, okay, and a systematic review? We already know like the cross-sectional studies, they take up a lot of time. They take up many years, even sometimes if you are going for data collection, it takes up a lot of time, okay? But for a systematic review and a meta analysis, you have to spend some good time in the first step, that is the topic selection. It can take up to a day or it can take up to many months. Okay, that's up to you. For me, personally, it takes me just a day to find a topic. Okay, and that's a good enough time to decide on a topic or stuff like that. Then after you have decided a topic, you can spend some good amount of time on this step. You can take up a month, you can take up 2 months, you can take up to 3 months to decide up a topic. But the later steps are as easy as you can expect. They are have to be done in a sequential manner, okay? So, and you have to complete your meta-analysis or systematic review in about 1, 2, or 3 months max. There is this craze of systematic review and meta-analysis right now, and just as you think of a topic, you cannot imagine how fast people are doing systematic reviews and metas on it, okay? And I will give you an example just in a while, and I will show you guys how that is happening, okay? So once you have decided your topic, you have spent some good time on it. Next step is secondary screening. You have to just give it around a week, and that's more than enough time to do that. Okay. Then the next step is data extraction. That also takes just like around a week max. Data analysis takes just 1 to 2 days. And if you are like going for a very detailed data analysis, it takes up to a week, not more than that. Quality assessment, once again, it takes just 1 and 2 days. And I'm not saying as an expert, it takes 1 and 2 days. As a person, I am a mentor. I like mentor my students, and this is the level of time that a beginner is taking. Okay, a person who is just starting systematic review and meta-analysis, this is the time that he is taking to do that. Okay, it's not for an expert. And then last time is the manuscript writing. Yes, manuscript writing does take some time. And if you are like an expert in cardiology or anything in that topic you are discussing, you will write a better manuscript and it might take you some time. But as a person who is like a freshly graduate, what he will be doing is he will just pick up stuff from different articles and write up his manuscript. So it will take him less time. Okay. So you have to keep a time of 1 to 3 months in your mind max for a systematic review. There was this topic and there was this debate a few days back in a few, I guess I just a few, like around 15 days back about Trump saying that paracetamol causes autism or ADHD in pregnancy. Okay. So I saw this on my Insta and I was like, yeah, I should be doing a systematic review and meta-analysis on this topic. I need to, like, there should be someone who can say, like, is this true or false? Okay. So for how you can do it using a systematic review and meta-analysis. So what I did is I made up my PICOs, I devised my research question, I assembled my team. And of course, in Pakistan, these months are like for exam season. So my team was a little bit slow. And let me show you guys what happened. Sorry, I was just doing practice of the stuff. So this was a paracetamol role in autism and ADHD. Okay. And let me show you how fast things are moving in regards to a systematic review and meta-analysis. No, this one is not this one. So this debate started in the start of September. Okay, in the start of September, around Trump made this statement that paracetamol is causing autism, and why he did so, of course, because there was a Harvard study that said that paracetamol usage in pregnancy causes autism. Okay, and in 1 month, there was this systematic review that got done and it got published. Okay, so that's how fast people are moving toward a systematic review and meta-analysis. So as soon as you get the idea, as soon as you get the topic in your mind, you have to be really fast. You have to just think of the topic, you have to assemble your team, you have to move on the other steps, and you have to complete it. Okay, you cannot wait. It's all a thing of speed right now. There was this debate on LinkedIn I was even looking at in a few days back, and they were saying that young graduates should not be given this authority to do a systematic review and meta-analysis. But the thing is that it's happening right now. And once the things are happening, we cannot stop it. We have to just move with it, okay? So people are doing systematic review at a crazy rate, and we have to follow along with it. We have to work hard for that thing, okay? And as I showed you guys earlier, it doesn't take much time. If you have a good team, it doesn't take much time to complete a systematic review. So, what is a systematic review and a meta analysis? Now we come to this question: why is it important? Systematic review and meta analysis. I'm really sorry. I think I got a little bit fast. Let me slow down a little bit. Okay. So, systematic review and meta analysis, it sits at the top of the research pyramid. Okay. It's the highest form of evidence. If you are confused between any two things in clinical research, in the clinical world, okay, you have to look up or you have to go towards the systematic review. Just as I told you guys, whenever this question came up on the or in the social media that does paracetamol cause autism or not, what was the highest level of evidence people were looking towards? That was a systematic review. Because what does a systematic review do? It combines all the information that is available on it till that time. And a meta analysis, of course, it strengthens that information. So, all the while it was said that paracetamol does not cause it, but there was one RCT, there was a one randomized control trial that was conducted by Harvard, and it said that no, paracetamol does cause it, and it threw off all the balance, and it needed a systematic review and a meta-analysis to prove it that it does it cause or it does it not. Okay, so like a person who is in Pakistan, he conducts a research on different drug, and a person in America, they conduct a different study, and one person says that metformin is a good medicine for diabetes, and a person in US, he says that it's not. How can you prove that it is or it is not through systematic review? Okay, it's all about the research pyramid. It's considering other studies also, but we won't be going through that. Okay. So what we are going to look at is the first thing, that is the topic selection, because this step is the most important. The rest of the stuff is about more of the technicalities, okay, like how to do screening. It's all like the skill set, okay. But this is the most important step, that you come up with a topic for your systematic review. By the end, I will share with you guys a tip also, a quick tip on how to make that easy, how to find out a topic. It takes me just like you can say 1 day to finalize a topic, and it is not that much of an effort if you are well versed in it. Okay, so by the end, I will share with you, and you have to stick with me till the end. That is just one of the, I guess I am using a trick of YouTube or Instagram influencers to make you guys stick till the end. Okay. So the first thing you have to decide is what is your area of interest. Okay. So if you are a person who is working in a cardiology institute, or if you are a person who is doing some medicine, or you are doing surgery, or anything like that, you have to narrow yourself down. Okay. For example, I can say, I am interested in, let's give an example of stroke. Okay. I'm interested in a person presents in emergency department with stroke. I want to see what medications I can give him to provide him the best treatment possible. Okay. And I'm doing a research on that. So first, what is my area of interest? I have narrowed it down. I have included neurology. Then what's my disease? It's stroke. Okay. I'm further narrowing it down. This step comes up, read up on available treatments. You have whatever disease you are going for, or if you are working in that institute, of course, you already know it, what treatments you people are using for stroke. But if you are not, if you are like a medical student, what you can do is give some time, spend one day reading up on it. Okay, see what different institutes are using, what medications are currently being used for stroke, are they good, are they not, and stuff like that. Okay, read up on available treatments. And what some people do is they seek expert opinion. Like I can go to my HOD of neurology and I can ask him what medications are being used for stroke, and I can compare between them. Okay. And then I will go for defining my research question and then further steps. Okay, let me tell you how to do this stuff. Okay, like let me give you an example also. When I was doing my rotation in ENT, that is ear, nose, and throat. Okay, so there was this tonsillectomy going on. Okay, and there a debate started between the HOD and the professor who was doing the SR who was doing the surgery. And one was like, we should go for the cold approach, and the other one was like, we should go for the hot approach. Okay, yeah, they were discussing about that thing, and I was like a person who was just freshly graduated, and I was not well versed in that stuff. What is a cold approach, what is a hot approach, and tonsillectomy. But I saw that there is a gap. There is a gap, like they don't have this idea that which one approach is better. Is hot approach is better or is cold approach is better? Okay, so even if you are some studying some guidelines, sometimes there is written like this thing. um, there the guidelines say that there is a little bit of deficiency in this thing, that is this drug good or is this drug not. Okay, so you can do a systematic review and meta-analysis on that topic. So I went up, I checked up, and there was no systematic review and meta published on the hot and cold approach. I started doing a systematic review, and you can find it out. Okay, there are many articles now on this thing. So other way is like if you are interested in neurology, subscribe to the journals of neurology, and you can see if a person is doing an RCT, if there is an RCT published on it, randomized controlled trial, if there are active studies on some topic, you can do a systematic review and meta-analysis on that topic. Okay, let me show you guys how to search it. Okay, I don't want to bore you guys with all the theoretical stuff. I will be including some hands-on approach also. Okay, so to make you guys also learn about it. And I would love it that after the end of this session, you guys are like so excited that you are like, now let's start systematic review. Okay. So you can always reach out to me also. So let me go for the approach. I was telling you about stroke. Okay. So I'm like, let's compare two drugs for medication for stroke, altiplase and altiplase and tenecteplase. Okay. For stroke. And I discussed it with my HOD, and he was like, yeah, these two drugs are both that are used in for stroke. You can compare them. Okay, so I got some like kind of an expert opinion. I'm like, let's compare these two. What I do is I will go on PubMed. That's like the best database that is available for free. So I will write here LT tenecteplase, and stroke. Okay, and then I will press enter. Let me search. Okay. Okay, so you have to make sure that there are three RCTs or three studies on this thing that you are studying. Okay, so I'm comparing LT-Place. This is one medication with another medication for stroke. Okay, and I have to make sure that there should be three articles published on it. Okay, otherwise I cannot go forward with this topic. So I see this one. Intravenous tenecteplase compared with alteplase for stroke. Okay, so I've got one RCT. I will move down. Tenecteplase versus alteplase for stroke. Another RCT. It is published in 2024 and this is published in 2022. Okay, so I will further scroll down and see tenecteplase versus alteplase for stroke. Okay, and this is again published in 2018. So I have got around three RCTs on this topic that I am studying. Okay, so I have done all this work and this criteria also cleared. One another criteria I have to fulfill before starting my meta, and that there should be no prior meta on this. Okay, so what I will do is body. Okay, I will search here LT plays, Tenacity plays, four stroke, systematic review, and meta analysis. You can search it on PubMed, you can search it on Google, or you can even use some AI to check is there a systematic review or not. Okay, so I open up this article, and there is an article published in August 2025 on this same thing that I was studying. Okay, so it's Tenacity plays versus LT plays for stroke, and it is published in 2025, just recently, 2 months back. Okay, 2 to 3 months back. Yeah. So that means now I cannot do on this topic because it's already published and there is a published. So two criteria that it should clarify, or it should qualify. There should be three RCTs on it, and there should be no prior meta on it. These two criteria it should always fulfill. Okay, if it is not, I cannot go forward with it. Okay, let me see. Okay, sorry. Okay, so let us go with another example, and that was that tonsillectomy thing. Okay, there was two therapies, two ways: coblation, that is the cold, and coblation and cauterization for tonsillectomy. Okay, I am going for this approach. I am comparing coblation with cauterization for tonsillectomy. Okay, so I've got first one, that is a comparison of coblation and tonsillectomy, and monopolar, that is the cauterization. I have another one, coblation versus electrocautery, two studies. Okay, what about others? Okay, so we have coblation, and again we have the monocauterization, three studies, coblation versus electrocautery, three studies. Okay, so it is justifying everything. Okay, it is justifying one criteria. Another thing I can see is there a systematic review and meta on it or not? And yes, there is a systematic review and meta on it, and it was published in January 2022. And you can even see this thing that when you will start exploring the topics, you will see that systematic reviews and metas are almost published on most of the topics. Okay, it's very difficult to find a good topic. But still, I will give you guys tips at the end also, okay, about finding a good topic. So, but one thing we can see from here that it was published in 2022, it has not been recently updated. Okay, it is not recently updated in 2025 or something like that. So that means I can do a systematic review on it, but for that thing, there are some other criteria that we need to clarify. Okay, for now, let's summarize it, but the things a little bit. You have to think of a disease, you have to narrow it down, you have to think of the available treatments. You will check, are there enough studies on it, and there should be no meta on it before. Okay. Let us move on. Okay, so in that thing, you have to, what is the PICO? That stands for population, intervention, comparison, outcome, and studies. Whenever you are thinking of anything for a systematic review, you have to answer these questions. One, two, three. These three are important. Outcomes you can ignore. Just like we were just discussing now, tonsillectomy. Okay. So patients who are undergoing tonsillectomy, that is my population. What is the intervention? Coblation. And what is the comparison? Cauterization. Okay. So I'm comparing two procedures in people with tonsillectomy. Furthermore, the previous one that we were looking at, and it was about, what was the previous study that we were looking at? That was about, yes, LT-plays and tenecteplase. So LT-plays is the intervention, tenecteplase is the comparison, and the people who are having stroke, that is my population. Okay, so that's all cool. I am I am deciding my intervention, I'm comparing it with a drug, and I'm deciding my population, and it is giving me some kind of like a clear thing that what is my systematic review and meta on it. So whenever you are deciding on any topic, you have to clear these three questions. One, two, three. You have to think what population you are going for, what is your intervention, what is your comparison. Okay? And in population, if you can be very specific, that's good. If you're like going for people in males, in if you're going for like any cancer, you are like a patient with in stage 4 cancer or anything like that, that's good. Okay, if you can define it further like that. But for now, when you are deciding on a topic, be as broad as you can. Okay, because it's not easy to find a topic. And if you will further specify it, like I need just males, I need just stage 4 cancer patients, it would be difficult for you. Okay, so be a little bit open. I am just looking for patient with stroke, I am just looking for patient with diabetes, I'm just comparing one drug to another drug. Okay, so intervention, comparison, just answer these three questions for now. Don't go into the outcomes, don't go for the studies, don't concern yourself with the follow-up time. Sometimes what even people do is they don't even concern themselves with the control, and that's totally fine. Okay, this is all according to the guidelines. None of this stuff is made up by me. This is all according to the Cochrane and Prisma guidelines. Okay. Not all studies have controlled, as we saw earlier, that role of paracetamol in causing autism in pregnancy. There is no control. There is just a medication that is paracetamol, acetaminophen, and it is causing autism in children in if a pregnant female takes it. Okay, so there is no control. So what is the control in that thing? That is always mostly people write it's using no. If a pregnant woman does not use anything and she is using paracetamol, comparison between that or a placebo or any established pre-established standard treatment. Okay, for example, if you are going for treatment of gastric cancer. Okay, so there is like one drug that is used for gastric cancer, and you are comparing it with a new drug that has just recently been launched into the market. Okay, so you are comparing that drug with a pre-established standard treatment. In that cases, you sometimes you don't even need to specify the control. And whenever I am doing deciding on a topic, I also concern myself with just population and intervention. Sometimes I don't even go for the control, because as broad as you can be when deciding a topic, it's good for you. If you limit yourself, that would make your topic selection really hard. Okay. Outcomes also, you don't mention the outcome in your search strategy, because once again, it will limit you and you are still deciding on the idea. So don't worry about listing them. I hope you guys understand what outcome is. Okay, outcome is just like if I'm comparing two drugs, as I told you guys, alteplase with tenecteplase, they are two just names of the drugs. Okay, so you can say drug A versus drug B for stroke, and what is the outcome? They both should prevent the death of the patient. Okay, so which drug is better in decreasing the death of the patient? Or in cases of cancer, I can say one drug is better than this drug in gastric cancer patients to help in the relapse. Okay, so you can go for that thing. As we have this now, I was telling you guys this because all the topics are getting saturated very fast, because everybody is like crazy about systematic review and meta-analysis. So now there is this trend of doing an updated meta. Okay, and I will be showing you guys about it now, because this is an important thing to know when you can go for an updated meta-analysis. Okay, you can go for an updated meta. It should satisfy either three of one of these conditions. Okay, one of these criteria. One first thing is three studies have been published after that meta publication, or one clinical trial has been published that has more than 25% sample size. Okay, or there is a topic that is just like that has blown away the internet. Okay, there was already a systematic review and meta-analysis published on role of paracetamol and acetaminophen on autism in pregnancy, and it said that there is no role in that. But that Harvard study, it blew up the internet because it said that acetaminophen is harmful in pregnancy. So it was a guaranteed thing that there should be a meta published on it. Okay, it needed to be revised, because there was one drug that just said that one study came and it said that it's not right. This is a problem. Okay, for example, you all are mostly diabetics, they are prescribed metformin. An RCT comes and it says metformin has no role in diabetes. Okay, So it's like a hot and trending topic. It's a new thing that has blown away the internet, and it's just like everybody's like, should we take metformin or not? So you can do a meta on it. Okay, it's you have to go for that topic, even though there is one study. You have to do a meta on it and you have to update it. If there is any result that has come that is contradictory to what was already being accepted, you can go for the updated meta. Okay, or or any of these conditions. Let me show you guys now. So we saw this thing. It's a comparative systematic review on coblation and tonsillectomy versus electrocautery, and it was published in 2022 January. There has been no meta published on this, okay, after 2022. And there has been like 2023, 2024, 2025, and we are almost at the end of 2025. So it has been 3 years, okay, and there is no meta on it. So I am like, I think so I should do a meta analysis on this topic. So can I update it or not? I have to decide this top. I have to decide this decision. First thing is the topic hot and trendy? No, it's not. Okay, because there is no thing like that, that there is a confusion. People are like, okay, people are not having any confusion regarding this thing. People are okay with all this thing. Okay, coblation is better than electrocautery. Okay, so this criteria is not fulfilled. Okay, now I have to check these two criteria. Are there three clinical studies after this meta publication? It was published in 2022. So I will go on PubMed once again. And here I will write coblation electrocautery for tonsillectomy. Okay. And I will remove this filter that is already being applied. I will go for all studies. So it was published in 2022. What I will do is I will bring my marker to 2022. I have to find 3 studies after the systematic review to update my meta. So there is one study that is in August 2022. And what about this one? It was published in 2022 January. So this is one study that is comparing coblation versus electrocautery. I will scroll down. Okay, this is a systematic review. It's a comparison of 3 tonsillectomy techniques. It was published in 2023 March. I have one second study. There is another one, coblation and cautery in adults, and it was published in 2023 May. That means I can go for updating this meta-analysis. Okay, I have got 3 studies, 1, 2, and 3. Okay, so this is one topic that's just like a topic that you can easily start a meta. Even after this session, you can start a meta analysis on this topic. It's already there. Okay, it was published in 2022 and there has been no meta after that. And we have 3 studies after this, 1, 2, and 3. And even if I scroll down, comparing coblation and tonsillectomy 2022 March, that's the 4th study. What about this is not included. This is also not included. And okay, BISACT, I guess this is cauterization. Here I will need an opinion of an ENT expert. And coblation, I guess this is also comparison, and it's published in 2022 July. So I have 5 studies after this meta. Okay, so I can go for updating this meta analysis. I can go for choosing this topic for a new meta analysis because it is justifying this statement, this criteria. Okay, one another. Okay, so suppose you don't find 3 studies on it. Okay, I have just one study after 2022. Now I have to see that does this clinical trial or study have more than 25% of the sample size. Now I'm going into a little bit technicalities, into numbers. Beforehand, we were just dealing with the theoretical stuff, but now we are going in the numbers thing. Okay. So now what you have to do is you will see this systematic review and meta-analysis that's already done on it, and it was published in 2022. I will see how many patients did they include. In the result section, they have written that we had 1000 participants in this systematic review and meta-analysis. So I will open up my calculator and I will see what's the 25% of 1000. Just doing it for you guys. My maths is quite good. Okay, so 25 into divided by 100. Oh, I have 25 over, sorry, 25 over 100 into, okay, into 1000. So it should be more than 250. Okay, any one clinical trial that is published after this, if it has more than 250 participants, I can update my meta. Okay, that happens in case if you don't have three studies. Okay, for example, there is this meta that was published in 2022, and there is just one study after 2022, and this is the study. Okay, I open this up and let me see how many patients have they included. I will open up this study and they have not mentioned in this here in the abstract. I will open up the full article. And here I can see in the methodology section, they would have written, okay, let me see how many patients do they have. Okay, it was mentioned here somewhere. Let me see how many patients did they include. Tonsillectomy, the study was conducted according to study design. Pediatric patients, the children. Okay, let me see. How many patients are they including? I will have to go for how many how many patients are they taking for the tonsillectomy or how many surgeries are we? Okay, I have to go through this stuff. The pediatric patients were over 6 years of age. Okay. Randomized control trial. I guess I will find this here. Okay. Group 1 has 16 patients and group 2 also had 16 patients. Okay. So that's just around 32 patients total, and that's less than 250. So that means I cannot update my meta. Okay. It's not satisfying this criteria. Okay, and that is in the case if I don't have more than 3 clinical studies after this meta publication. Okay, if it is satisfying this criteria, I'm fine with it. I can update my meta. If it satisfies this criteria, I can go for updating my meta. I don't need 3 studies, 3 clinical trials, or 3 studies after the meta publication. Okay, so let's move forward. Okay, another thing I can do, I can update my meta is if I change my population, if I change my intervention or anything like that. Okay, so once again, let me show you guys. There was a systematic review and meta-analysis on laparoscopic, totally laparoscopic versus laparoscopic assisted gastrectomy. Okay. What does it mean is a surgeon is using totally a laparoscope or he is just taking assistance from a laparoscope during gastrectomy. Okay. And I find the systematic review and meta-analysis and I find this topic good. How I can update it or how I can think of changing this topic is I can go for totally laparoscopic versus laparoscopic assisted and not define myself with just gastrectomy. I can go for all abdominal surgeries. Okay, I can go for gastrectomy, hysterectomy, any kind of hepatectomy, any procedure, and just comparing these two things. So what I have done is I have changed my population. I have not changed my intervention. I have not changed my control. I have just changed my population and now I can do an updated meta on it. Okay. So these are some of the tactics that you can use to upgrade and update a meta. Okay. Because if you're not finding any topic, that's totally fine. You can just pick up one topic and update on it. Okay, so if there is an article published on this systematic review, and I can tell you guys for sure there is no systematic review and meta-analysis published on this totally laparoscopic versus laparoscopic assisted for abdominal surgeries. Okay, you can go for that, and it would be novel, it would be nice, and it would get published easily. And what more help you can take is you can even take help from this article using these tables they have used, using their ways of analysis, and it would guarantee your publication in a very high journal. Okay, so this is all the steps you can use for updating a meta analysis. What we have covered so far, we have thought about the topic selection, how you finalize a topic of interest, your topic, you narrow it down into the interventions, the treatments, and you search it up. Okay, and how you can update your meta. Okay, let's move on. This is I always only have 16 slides, so you guys don't need to worry about, we are already on 14th slide, so it's all fine. Okay, we are going at a good pace. These are the three criteria that you all should remember when updating a meta-analysis. It should satisfy one of these conditions. Okay, and for going for our topic, these two things are important. It should have no prior meta on it, and it should have more than 3 RCTs on it. Okay, let me open up my study. Okay, sometimes this happens that in order to do a systematic review and meta-analysis, what people do is they just go for proving what they want to prove. Okay, for example, I'm doing a systematic review and meta-analysis on aspirin for pregnancy-induced hypertension, and I want to say it's a nice medication. Okay, I am being funded by a pharmaceutical company, and it's like it's supporting aspirin, and it wants me to write a meta-analysis on aspirin usage in pregnancy-induced hypertension. What I do is I just include those studies that are saying aspirin is good, and I exclude any study that's saying it's negative. Okay, and what happens? 6 studies are there, they are showing positive results. It is satisfying both the conditions. First condition, there should be no prior meta on it. There is no prior meta on it. Second condition, there should be 3 RCTs on it. Yes, there are 6 RCTs on it. So, according to the definition, this meta is complete. Okay, I can do a meta on this thing. But what will happen when I will submit my article for publication? What the editor will do, if the editor is good enough, he would do a quick search and he would see that there is a study of around 9,000 patients and they have reported negative results. So my meta would be rejected on spot because of this thing, because of not being fair enough, or because of not doing a comprehensive research or comprehensive search of the studies. Okay. So what you have to do is you have to be as fair as you can. Even if your results are negative, that's totally fine. There was one of my student group, and they were doing a systematic review and meta analysis on the usage of a drug for septic shock, and that drug, it had around 9 RCTs on it. Okay, so that's a big number. You will guys will see when you will start RCTs, you just find 3 to 4. Okay, there was like 9 RCTs on it, and they were like, should we go for this topic or not? Because that drug was not promising for septic shock. And what was my answer was that yes, we need to go for this topic because it was a very trending topic and it was being investigated extensively in 2025. In 2025 specifically, there were 3 RCTs on it, okay? And they were just like, it's not good, it's not good. They were all reporting this thing. So even if the results are negative, you have to report them. Okay, even if the results are saying that aspirin has no usage in pregnancy-induced hypertension, you can do a systematic review and meta on it. Just be fair, include all the studies and go for it. Okay, do it as you can. Okay, so as good as the study as you include in it, your systematic review and meta, it has more chances of publication. Similarly, if you are, this is a very important slide. Sometimes people are like that narrowing down thing, the filtering thing. They're like cardiovascular complications after organ transplant. It's a very broad topic. There are 120 studies on it. You cannot do a systematic review on these many studies. It would be so hard. You cannot do a meta-analysis on these 120 studies. It's too broad. Okay. So you have to narrow it down a little bit. Either you can narrow this one down or you can narrow the population. You will go for okay, so we move on to a ventricular fibrillation after lung transplant and you find just two studies on it, this topic is too narrow. And it's a good one if you have three studies on it. Okay, so what you do is now you have found something like there's too broad and too narrow. What you have to find is something in between. So you move lung transplant, you can even go for ventricular fibrillation after organ transplant or arrhythmias after lung transplant. So when you do arrhythmias after lung transplant, you find out there are 20 studies on it and you can go for this topic and the topic is just right. Okay. So these are some of the stuff you can do it. We have reached almost the end of our session, just a little bit stuff left. This is the forest plot, okay. And when I had not started my systematic review and meta-analysis, when I was starting it and I was a beginner in research, this thing scared me a lot. And I was like, I did not get the hang of it. I was like, how can a person make this thing up? How can they write about all these studies? And how will I draw this thing? How will I do these estimates? And what about these p-values? There are so much. What about these standard deviation? One thing I can let you know, this whole graph is made by software. Okay, none of this is made by us. This whole, you just add the data into a software, that's revman, and it automatically generates this whole plot. Okay, so a quick one tip I can share with you guys, that is the complexity that is surrounding systematic review and meta-analysis. When I had not started, I was like, I was never, I will never be able to learn it. Okay, it's so hard, it's so complex, it's all systematic. I need to be a data analyst to learn this thing. But the thing is, it's not hard. It's way, way too easy. And it's sometimes I can even say it's easier than doing a cross-sectional study, because you're not going to the patients, you are not collecting data. The only critical step is to think of a topic. Okay, and once you have found the topic, it's just a ending thing to do. Okay, so we have reached almost the end. Let me show you guys the tip and the trick to do the to find out the topic. But one thing before that I wanted to show you, that was let me open up this okay, let me find it out, I guess. I hope I'm able to find it. Yes, this one. Okay, so it was a meta-analysis that was published in 2022 in April, and it is about effectiveness of two drugs as a treatment for mental cell lymphoma. Okay, so these are true for mental cell lymphoma. It's a rare disease, and they are comparing two drugs for that. What you can see here, what the thing that was impressing about this meta-analysis that I wanted to share with you guys was it is conducted by just two authors. That's such a thing that I'm just stressing again on it, that how easy meta-analysis it on is. Okay, so it's just conducted by two people and they have conducted a good research. And what have they done is they have included just two RCTs. Two RCTs were included in this study, nothing more, not around 150 researches or 10 researches and all that stuff. This was a trending topic. There was no treatment for mental cell lymphoma as like a definite treatment. What they did, there were just two RCTs on it. They just compared it and published it. Okay. So this is how like you can just be even if you are two friends, you are two people who know how to do a meta-analysis, you can just go forward with the topic and you can publish it even if there are just two RCTs on it. Okay. So now let me just share with you guys how you can find the topic, and hmm, then we will just wrap it up. Okay, so this is a quick tip how even after this session you can spend just 1 hour and you will find out the topic. Even I have shared with you guys one topic in this session already. One thing you have to do is you have to narrow it down a little bit. Okay, are you going for cardiology? Are you more inclined towards neurology? Are you more inclined towards pathology, pediatrics, gynae, whatsoever? Okay, you have thought out this thing. I am going for whatever you can say. I say a little new thing. Okay, so let's go for renal cell carcinoma. Okay, something that's carcinomas are very rare, so I can go for this thing. I write here renal cell carcinoma. Nothing more. I have just stated my population, and I will press this RCT filter, and I will decrease the RCT's timeline to 2024 and 2025. I'm just going for the new topic, the novel topic that is being currently researched on. Okay, I'm going for that. Okay, so they have written the first RCT that's coming in my 68 results. That is the comparison between belzutifan versus everolimus for advanced renal cell carcinoma. Okay, so I think I'm like, yeah, I should go for this topic, and it will take me just time, but this is the first one, and I'm going to compare it. I will write here Belzutifan. And this is for those people even who don't know this stuff. Okay, I'm not a nephrologist. I don't know what these two drugs are, but I'm just comparing them. Okay. Of course, a nephrologist would be better able to guide you. Are these two drugs comparatively used? But that's the thing because an RCT is being conducted on it, so it's good. We are safe here. Okay, now I have seen, I have narrowed down the topic. I have to satisfy my three criteria. There should be three RCTs on it, and there should be no prior met on it. Okay, so this is the first RCT on it. Bezlutifan versus everolimus for advanced renal cell carcinoma. I cannot even say the name properly. So it's August 20, it was published in August 2024. And then there is another study, and it's published in April 2025. 1, 2. What about this is not okay. So I've got two RCTs on it. Okay, and then I write here belzutifan versus everolimus for renal cell carcinoma, systematic review and meta. I am searching, I am checking the second criteria. Is there any SERMA published on it or not? Okay, so this is a clinical trial. You can see here. Okay, it's not a systematic review. I will go back. Let me check the second one. Okay, it's no, it's a belzutifan inhibitor. It's a meta-analysis, but it's not on the thing that we are discussing. Okay, we will go back. And the second one, let me check this one. This is also on something else. Okay, it's not comparing belzutifan with everolimus. Okay, so that means I can do a meta on this topic. But I just went for the first topic that came up. I can even do this thing that I check the second one, it's on pembrolizumab, and the other thing I can search it up. I can see is there a prior meta on it, and then I will check are there enough studies on it, and then I can go for doing the systematic review and meta on this topic. Okay, so what are we doing is what's the purpose of this stuff is we are seeing what are the recent studies that are being conducted on this topic. Okay, so whenever I'm bored or when I'm not doing any active work, I go on PubMed and I just start, okay, let's go for dilated cardiomyopathy. Okay, let me see, is there any specific treatment for dilated cardiomyopathy? And I will just bring my parameter to this. What are the studies that are being conducted on this disease in 2025? RCT is already selected, and they have seen placebo controlled or okay, so we have this is a little bit of a different stuff. There is no drug here. Okay, so yeah, we have this drug, but I don't know how to say it. It's curicansin whatsoever, and it's comparing for dilated cardiomyopathy. Okay, so what I can do is I can write this name. Let me just copy it because I cannot pronounce it. Okay, no, let's go for this one. Olmesartan and valsartan. Okay, let's go for this. I will check, are they sartan and valsartan? Okay, sorry. That's it. for dilated cardiomyopathy, and it's saying there's just one study on it. So of course I cannot do a meta on this right now, okay, because one study does not qualify for being included in the meta. Of course, if there were 2 or 3 studies, it would have been better for me to go around doing this topic. So what I will do is I will spend some more time, I will go down, I will see any other drug, alcohol exposure, tamoxifen, Duchenne muscle dystrophy. So that's how you can easily find a topic and go for those diseases that do not have a proper treatment, okay, and that are mostly the cancers. Okay, the cancers are not properly being treated, they don't have any definite treatment. Or go for diseases that are like very long autoimmune diseases, cancers, or diabetes, hypertension. They are all trending topics, and you will find many studies recently conducted. Okay, so what I'm doing is I am seeing what are the RCTs done on it. Or another way is, if you are into neurology, go for subscribing journals related to neurology, and you will find what are the recent studies being conducted on it, and then you can check these 2 criteria. Are there enough studies on it? Is there no prior meta on it or not? Okay, so yeah, that was the end. Thank you. That was all from my side. If you have any question, just let me know and I would be there to answer them.
Thank you very much, Dr. Somia, for this informative and highly practical lecture.
You're
The way
welcome.
how
Thank you so
you
much.
broke the way how you broke it down into a structured evidence from the basic synthesis was extremely valuable, especially for those who are working toward publication. Um,
Hmm.
Many like new researchers, and they, as you mentioned, they are a bit hesitant to do meta-analysis due to the complexity that they are
Yes.
expecting or experiencing. Now we have few minutes left for the few questions to ask. A question from Bilal. He is asking if you can explain diagnostic meta 2 in parallel as interventional systematic review and meta-analysis are discussed.
Okay, so we have discussed about the intervention meta-analysis. Okay, that was about comparing 2 drugs, like which drug is good for this thing. Okay, for a diagnostic meta-analysis, you have to compare like which is the procedure that is currently being used for this disease. Okay, so like I guess my screen is being shared already. So here, like if we go here, and we have pro BNP for heart failure. Okay, and I can go here and I can write pro BNP and heart failure, and I can go for the diagnostic meta-analysis. In diagnostic meta-analysis, we just compare 2 different diagnostic procedures. That's the only difference we have here. Okay, it's nothing more. You are just seeing like, is there any way, like if pro BNP is normally used for heart failure? Are there any new studies? All those things that we already talked about, that are there any new studies that are comparing, that are giving new diagnostic procedures? So we will go for that thing.
Thank you. Another question from Anthony. What software do you recommend? You mentioned that everything is happening through a software. So what is your recommendation for the best software for meta-analysis? Do you use R or any other software?
Okay, so R is a little bit difficult. Okay, for beginners who are just like starting meta-analysis, I never recommend R. Okay, because R, whenever you mostly mentorship program, what they do is they start with R. Okay, and by the end you are done with the whole program. You are like, I cannot do it without the help of an expert. That's the only conclusion you can draw. But if you are going for RevMan, it's very easy. It's very beginner friendly, and you can just learn it in a week or so. Okay, so it's better. I would recommend for people who are just starting, go for RevMan.
So
REVMAN.
Revman,
Yes.
yes. Yeah.
Hmm.
Thank you. Now, back again to the meta-analysis. If you experienced a very high heterogeneity in the meta-analysis, is that means that the validity of the results is questionable, or you can justify them?
Yes, if you can justify them, that's the best thing you can ever do. Okay, so sometimes this happens that you have 2 different studies. There are like very heavy researches that are supporting positive side, favoring the intervention, and there are studies that are favoring the control group very heavily. And if you can justify them in any way, through the heterogeneity or the other things, yeah, there are some like technical aspects that you learn along the way, how to explain it further by subgroup analysis and all that stuff. That's the perfect thing you can ever do for a meta-analysis, okay? So in the discussion section, and there you always need the help of an expert or a person who is good in that thing to
Right.
clear it in your discussion.
For the interpretation. And also
Yeah.
I can see many early researchers also joining us tonight. You have highlighted the research question, the importance of the research question before starting the systematic review.
Yeah.
So that what is the common mistake that everyone is doing when they start their research question?
Okay, so one thing is they just jump in. Okay, so just like I show you guys how to finalize a topic. So it's not that easy. Okay, you are just like going around and just comparing two drugs and just the population. You have to, yeah, that's the thing that's important is you have to a little bit spend some time on it. That are these two drugs already being used or not? Okay, so like I was just showing you guys at the end, like comparing bevrolizumab with everolimus, whatever for advanced renal cell carcinoma, you have to first ask a researcher, a nephrologist, are these drugs currently being used, or have they been outdated, or something like that. So that's the important thing. You cannot just choose two drugs and the disease and jump right in. Okay, you have to see properly, are there enough studies on it? Is it a new thing? Is it novel? Is it good or something like that?
And the
That's the
final,
important thing.
thank you, Dr.
Mhm.
And the final question before we conclude, with the rapid advancements of AI, um, what are
Yeah.
the key ethical consideration that you are worried about, and what else you
Mhm.
recommend for selecting
Right.
the proper AI tools, the contributing factors to a success, and to avoid mistakes or bias or problems in the research itself or the meta-analysis.
Okay, so I'm not a person who is against AI. I'm totally a fan of it, and I would even say that it helps you a lot. Okay, so but there are, yes, I will highlight the problems that come along with it. The firstly, let me tell you about the pros. AI is even helping you do the topic selection. Even it will help you in data extraction. It will even make the whole data extraction sheet. Okay, the people spend like 2 weeks on it. It will help you make the whole extraction sheet. Okay, you can use Perplexity, and in a matter of minutes, you will have the whole extraction sheet. And if you will ask him to ask him or her, whatever, you will ask it, help me with the analysis, and it will do the whole analysis for you. Okay, so that's the pros of it. But yes, you will see later on that there are too many problems. Okay, it does not pick up the right data in the data extraction sheet. It does not include the right studies, and it does not do the right analysis. Okay, so you can take help from it, and it's a very good thing to do it. You can take help from it, but you need to know the steps. You need to know, and you need to know properly what variables are you going to extract, and like you can take help from it but you cannot rely on it. There are too many chances of a bias. And when it comes to writing the discussion, some people go for just using AI. It's not right. AI just makes things looks nice, and it can help you come to that thing. Okay, it will help you shortlist those specific articles that you need to go through them, but you have to go through them by yourself. Okay, because you cannot have that in-depth analysis with just AI. You have to work on it by yourself.
Well, thank you very much, Dr. Somia. Thank you all for attending tonight's session. And
Mm,
from all of us, a special thanks to you for the excellent practical presentation. We
thank
hope
you.
this webinar has equipped you all with a very useful tools to select the right systematic review and meta-analysis. Please stay engaged, keep learning, and we look forward to seeing you all in a future IVPN events, and have a great day ahead. Thank you very much all.